Hi, my name is Austin, and I'm going to do a musculoskeletal and neurological exam on my patient Brad. So the first thing I want to do is I'm going to start with doing range of motion of hands, arms, and shoulders, and I'm also going to palpate for pulses. So I'm going to palpate the radial and brachial pulses. So I'm going to palpate here on both arms, feeling that they're strong and equal, and then radial and strong and equal there. I want to see the muscular strength of his hands, so I'm going to have you just put your hands out flat, move our fingers, seeing that everything's moving equally from one hand to the next. Squeeze my fingers, okay, pull me towards you and push me away. So that just lets me know, or that kind of let me assess his arm strength also. So take your hands out again, and then if you can just make a fist. And don't let me open your hands. Good. Good. So both strong bilaterally, and then let's just see the range of movement. So if you keep twisting around. Okay, good. So the same thing with your arms. I'm going to have you first just bend your arms at the elbows, 90 degrees and down, and then I'll have you just straight out from your body, and then in front of you, and then if you can, push back. And then with your shoulders, I'm going to have him shrug his shoulders. I'm going to feel that that's symmetrical. Good. And then if you, he's pushing his shoulders back, he's moving his shoulders forward. Everything's symmetrical and equal, strong there. So next I'm going to look at his lower extremities. So I'm assessing for some symmetry. I'm going to look at the characteristics of his skin and for equal hair distribution. And I'm also going to be assessing for any possible varicose veins. So I'm going to just pull up his pant leg here, looking at both legs to assess against the other. So I'm seeing even hair distribution, no bruising, lesions, or swelling or anything on his skin. No edema here at all. So I'm going to take his socks off real fast so that I can look at his feet and ankles, and then I'm also going to palpate his pulses here in a little bit. Not seeing any varicose veins. So I'm going to go ahead and palpate his pulses. So I'm going to palpate the popliteal pulse first. Okay, those are strong and equal. And then the posterior tibial, so kind of hard to find. Feeling those both equally, and then the pedal pulses. Feeling those strong on both feet. You can go ahead and pull your pant leg down. So now I'm just going to assess the range of motion of his hips, knees, ankles, and feet. So let's just start with your feet first. So let's go ahead and kick a foot out, push down on my hand like a gas pedal, and pull back. Good. And can you just rotate your foot kind of in a circle? There we go. And then let's do this one. Down like a gas pedal, pull back, and then rotate your feet. Good. Okay. So here with his knee, I'm going to see if he can, it has full range of movement. So I'm already seeing him be sitting in a 90-degree angle. I guess we'll go ahead and stand for this. I just want to see you be able to pick it up and hyperextend and push it back. Good. So that's equal movement there. And then for his feet and ankle, I assessed his feet and ankles really at the same time. Let's go ahead and look at his hips. How you lay down. So then just one leg at a time, if you straighten your legs, let's pull your right leg up and bend your knee at a 90-degree angle, and then pull your knee back to your chest. Good. And then take this knee and out to the side, and then straight back down. And the same thing with this one. Up, 90-degree angle, pull it back to your chest, out to the side, and push it back down. So seeing all of the good easy movement and equal bilaterally, so you can go ahead and you can jump up. Before he sits, I'm going to have him do the deep knee bend. So I'm just basically going to see him squat, go at a 90-degree angle, go past 90 degrees, and then come back up. Are you having any pain, any crepitus, any popping that hurt? Okay. as he sits, I'm going to have you turn around, right? Yeah, so I'm going to look at his spine now. I want to see if he's sitting straight and tall, if he's hunched over, any signs of scoliosis or kyphosis. I'm seeing a good, strong, straight spine here. And you can go ahead and turn. So for the range of motion for his spine, I basically just want to see that he can bend over, in half without any issue, and then come back, and then try to lean back too. With my pressure on the back of your hip, good. So the extension and the flexion is there. And then I'm going to have you tip to both sides, and then rotate both ways. Okay, so good spinal movement there. Any pain with that? No. Okay, for his spine and for his hips, I want to assess his gait. That's important, so go ahead and jump up one more time. And I'm going to have you start right there. I'll have him walk towards me and then turn around and walk away. And here I'm just looking to see if he's having any issues with his gait at all related to his hips. Let's do it one more time. Spine is straight, legs are straight, not having any feet or knee issues, so that looks good there. So while he's standing, I'm going to do the Romberg test. Basically, this will be assessing for any drift. So I'm going to have him close his eyes and raise his arms out in front of him. And generally, we would count to 10 and see if in that 10 seconds they ended up having any drift with their extremities, but he's doing fine, so I'm going to let him go ahead and sit. So for the neurologic aspect of things, I'll start with a Babinski reflex at first, checking his feet, see if that reflex is intact. Running my thumb along. He's got ticklish feet. You have to let me do it. Oh, what a baby. So, good Babinski reflex when he let me do it. So, you want to be looking at coordination and skill movements. So, one of the things I can do to look at that is a rapid alternating movement. So, I'll have him basically touch all of his fingers to his thumb rapidly over and over. Seeing that he's coordinated to do that, and then you're good there. We're going to have him close his eyes, take both his hands out to the side, finger to nose, and keep doing that until I tell you to stop. This is basically looking for past pointing to see if he's going to be reaching in his ear, missing his face entirely. You see that sometimes with strokes and brain injuries. Go ahead and relax. And then something for coordination I can look at that a neurologic deficit will sometimes show. I want to see if he can take his heel and run it down his shin and bring it back up. And then, good. And just following the line of the shin, making sure he isn't neglectful from one side to the other. Okay, so I'm going to do the position sense test. So I'm going to take one finger and I'm going to move it either up or down, and he's going to be able to close his eyes but still tell me which direction I'm moving his fingers. So he can tell me now. Okay, and then we'll do this hand. Okay, so not having any issues there. So the sensation, sometimes at the hospital we'll do this with actually like a needle, something kind of sharp. We might use our fingernail to do a noxious stimuli, or something soft like a cotton tip or cotton tip swab or something like that. For now, I'm just going to have him close his eyes, and just to see if bilaterally from one side to the other, if sensation is all the same. So I want to let you know, or I want you to tell me if you feel my touch and if it's hard or soft. So,
Soft. Hard.
okay.
Soft.
Okay. And then we're going to do arms.
Hard. Hard.
Good. Hands.
Soft. Soft.
Okay. I'm going to do legs and feet.
Hard. Hard.
Okay.
Hard. Soft.
All right. Okay. All right. Okay. So I did face, hands, legs, and feet for the sensation, and he had equal sensation bilaterally from side to side. So the last thing I would need to be assessing is his deep tendon reflexes. I don't have a reflex hammer, but I would essentially want to be looking specifically in 3 places. So the brachioradialis, I'm going to be checking here, kind of on the insides of the wrist. Whenever the hammer is hit in this spot, you should see the hand basically kind of twitch like that, and it should do that equally on both sides. The next place you want to look for the patella or for the knee jerk reaction. So you basically hit right here under the kneecap, and at that point you want to make sure their leg is dangling freely. You hit them here, and you should see a little kick there. And then the Achilles, back here on the Achilles tendon, you're going to hit this with the hammer, and you should see their foot flex. And that sums up my musculoskeletal and neurologic assessment. And I think we're done.